Should private dentists be forced to take on NHS patients to ease the burden on demand? Recent figures show some people are waiting 4 years to see an NHS dentist, and a third of registered dentists aren't making any contribution to the health service by taking NHS patients.
Well, joining us now is Kerry Riches. Now, Kerry worked in a customer service role in an NHS hospital for 20 years. She is still struggling to get onto a dentist's list.
In fact, she's thinking of driving to Bristol.
Yeah.
To get in the queue.
Because, as we know, this morning there is a dental surgery in Bristol that is opening up 100 spaces for NHS patients at 1 o'clock this afternoon. We don't know if those people there are queuing.
Or waiting for a bus.
But these are the pictures from last year. There were queues around the block and police had to be called because there were so many people blocking pavements. So Kerry says, let's make dentists take on NHS work. But dentist Trishala Lakhani works in a private dentist clinic. They do take on NHS patients. And Trishala, you said it should be your choice, not a forced decision by the NHS and the government.
Absolutely. So I take NHS and I take private. So from someone who sees both sides, I just fully believe that autonomy is super important. No dentist should have that imposed on them that they have to do NHS, they have to do private. I do think it's a dentist's choice.
Although it costs us, the taxpayer, £300,000 to train a dentist. And it's true that dentist students make a contribution to that, but so do we as taxpayers. Shouldn't you at least have to work some of your career in the NHS if you've been trained by the taxpayer, by the NHS?
So it's a really good point. And while we are studying, we do actually see NHS patients from our second or third year. So we are seeing patients then. When we do graduate, most of us do go on to do a foundation training year, which we learn a lot of. Some of us even do further training. So I did a DCT year, which means I was in hospital working in all cancer departments. And there are pathways for that.
And who pays for that training?
So...
The NHS.
The NHS.
Right.
And the government is saying
so the frustration is that basically the NHS pays for your training, but then it's your choice whether you treat NHS patients. You could just become a private business treating
but the
private
problem
patients.
here is we're making it NHS versus private when it really shouldn't be. Private dentists, they have their roles. For example, if you want to do aesthetics or cosmetic dentistry, or you want to do Botox or facial aesthetics,
sorry to
the
interrupt.
NHS
I'm really sorry to interrupt.
You just want a filling.
Yeah, I do. Can you please fill my tooth after this debate, please? No. The problem for me is, from someone that worked in a big NHS acute hospital during COVID, I saw the reality of people providing their own dental care. People were extracting their own teeth. People were buying online filling kits and filling a hole that is not clean and safe to do so. And as a result, have come back to A&E with infections, with abscess, having pieces of their jaw removed, and worse still, dying of sepsis. That's unforgivable.
I completely
and I
agree
do
with you.
genuinely believe that if you go into a healthcare profession, you are a care provider, you absolutely need to provide, in my opinion, 80% of NHS appointments. I'm so passionate about it. I worked for 7 years as well in primary care, looking after dentists. I know all about UDAs. I know what you go through. And I know it's more lucrative to do private, but that's not OK.
I do completely agree that no one should be taking their own teeth out or DIY dentistry. We should not be doing that.
What choice have they got, though?
But the problem here is the NHS dentistry. It's not a dentist. It's not as simple as, say I'm a fully private dentist. I can just see a patient and say, right, I'm taking you as the NHS. Each practice has a contract with NHS England, and with that contract, that enables practices to then take on NHS patients.
But a third of dentists are not having a contract at all to do any NHS
but that's
work.
a problem with NHS England and the underfunding on that aspect. It's not really an individual
I'm all about
problem.
patient choice, but unfortunately the dental practice have removed patient choice. We can't decide. I'm all up for if you want the white filling, pay £90 for it rather than have the silver one. Don't get me wrong, we've all done it, I'm sure. I mean, I haven't got I'm literally haven't got a filling in my mouth. I've had good teeth for many years, but now when I need it, I've never found it more difficult and so much pain for what I'm going through. I mean, genuinely, we've all done that, but have the choice at least. And we don't choose to have teeth. We're born with them. They have to be looked after. Could you imagine if people turned up at A&E and we said, no, sorry, not today, we're only seeing if you give us £100 to see you?
Yeah, Trishala, can I ask, what is your waiting list for NHS patients?
We're actually taking on NHS patients now.
So you do... Right, whereabouts are you?
Exactly.
I'm South East London, in Bromley.
OK,
Yeah.
so there
Postcode?
isn't a shortage.
It's not like there's a shortage, but in some areas of the country, dental deserts really do exist. But like I say, it's the problem where there are the dental deserts. It's NHS England. We're cutting funds year on year, even though the problem is increasing. It's not an individual's dentist problem. I don't know any dentist, none of my dental friends, me, would never want to see a patient in pain, never want to turn away a patient. But if NHS haven't given us that funding and we've reached maximum capacity, we physically don't have the resources to be able to see
Kerry,
these
do you
patients.
live anywhere near South East London?
No, I don't. And I can't find an NHS dentist at all in Essex. This is a plea. Can you please get in contact with me if you are an Essex dentist taking NHS patients? So I promise you, there is not one.
Are you on a waiting list?
Yes, I'm on. No, you can't be put on a waiting list. You have to. I have to phone my dentist every single day and see if they've opened the books or they've allowed another 10 patients to become.
And how long have you been doing that for?
I've done it for the last 2 years.
Wow. So why is there an issue in Essex but not in South East London?
So it's a kind of, like I say, it's a contractual thing. And like I say, year on year, the NHS have cut the funding, which they shouldn't have. The problem's been increasing. The thing is, lots of dentists, there's no doubt about it, are leaving the NHS. And debates, you should, you shouldn't, but it's not a fit-for-purpose system.
Right.
We, NHS dentists, are working chasing targets, and a lot of people leave because of the mental stress and the mental pressures of chasing targets. Healthcare should never be target-driven. It should be patient care and patient needs-driven. So that's why a lot of people don't want to work under the NHS for that reason, and they'd rather go private.
But Trishala, the thing that I'm hearing above all else is it does not make you enough money to have NHS patients. And there are people who, as a result, not in your area, I appreciate, but in some areas, who therefore take out their own teeth and go to A&E with sepsis.
So every NHS practice, or if you call 111, you will be seeing that same day. I know, Kerry, you actually did this. You got seen the same day. So it's our duty under the NHS to ensure a patient is out of pain. So even if you're not registered to any
emergency
practice,
dentistry
you can
is available.
Absolutely.
Yeah.
But then when I
Let's
went
never
to my
be left in
receptionist
pain.
to book the follow-up treatment, thinking I'd be under band 3, which would be around £300, they said, oh, we'll have to see you as a private patient. It's going to cost you £1,200. That's not acceptable.
Yeah. Well, Trishala, we asked our viewers, should private dentists be forced to take on NHS patients? And 84% said yes. Basically, those people waiting, people like Kerry, want there to be compulsion.
I completely empathise, and no one should be waiting years. Children should not be waiting years on the NHS to have their teeth taken out. That is absolutely awful. But we have to also, with the way it works, it's like I said, it's not an individual dentist's choice. The NHS need to give us more funding, make it a system where dentists do want to work within the NHS.
Thank you both very much indeed. Kerry, good luck.
Thank you.
And we'll let you know if any Essex dentists get in touch.
Want to help me out?
And if you don't go to Bristol, go to Bromley.
I'm on my way.
Yeah.